Hello guys, and welcome back to my channel. Thank you so much for being here today with me, and welcome. If you're new here on my channel, hello, my name is Dani. I am living with a chronic condition called hydrocephalus, and I am posting videos on this YouTube channel about what it is like to be living with this condition and how to manage everyday life. I have been postponing this video for a very long time now. I've been dying to film this video and to share it with you, and finally today I decided to sit down and talk to you about what it is like to be going through IVF or fertility treatments if you have hydrocephalus. As you know from my previous video, which I will link in the description box below, I have started an IVF cycle. I am currently on day 4 of my first IVF cycle, and hopefully last. Fingers crossed. Please guys, keep your fingers crossed for us, pray for us. And yeah, so I am currently on my day 4 of injections, and currently it is my cycle day 6. So when I first started doing my research and being interested in fertility treatments and IVF, as someone with hydrocephalus, I was looking for information about do's and don'ts, what I can do and what I cannot do, if there are any restrictions to the process, if there are different protocols for someone who has hydrocephalus and a VP shunt. So for those of you who don't know what the VP shunt is, because of my condition, because of my hydrocephalus, there is a constant buildup of fluid on my brain, and that fluid cannot be drained naturally. So for anyone who does not have hydrocephalus or does not have a brain condition like I do, that fluid is being drained naturally. There is a system in the body that works quite well. It works really well for everyone else who does not have a condition that is altering that drainage of the fluid. However, for me and for people that do have hydrocephalus, that fluid is retained within the brain and elevates the cranial pressure to levels that are not normal and that are dangerous. So that fluid needs to be drained somehow from the brain. And in my case, I have a ventriculoperitoneal shunt. This is a tube that drains the fluid from my brain, from where it is stuck and cannot drain, and into my abdominal cavity. And there in the abdominal cavity, that fluid can be resorbed by the body and can get flushed naturally. So basically, this is something that I need to tell every doctor that I go to, that I have a VP shunt and I have a hydrocephalus. So one disclaimer that I would like to make before I start talking to you about actually my journey and about what is happening with my fertility treatments is that I am not a doctor. I am a pharmacist by education and a psychologist by soul, and by education now as well. So I am not a doctor, I am not a fertility doctor, I am not a neurologist or a neurosurgeon. So please, if you have any questions, reach out to your doctor. They should be able to answer any and every of the questions that you might have. If you want to know anything in particular about the protocol that I am going through with my hydrocephalus, or anything about my journey, please leave a comment below. I will make sure to answer all of your comments, or you can reach me on Instagram. I'm so happy about the community that I'm building in Instagram with people that are living with hydrocephalus. This is so rewarding to me. Like, I cannot tell you how rewarding it is to me to be receiving messages, to be receiving DMs, questions, to be seeing comments that my content has helped someone. This is the best thing ever. This is the best feeling. So please do not hesitate to reach out to me, ask me anything. If you're interested, I will make sure to answer as good as I can. But again, I am not a doctor. Reach out to your specialist. They should be able to help you if you have any medical questions. Please make sure to like this video, and if you're new here, please hit subscribe. And if you enjoy this content that I'm making, please be welcome to stay on my channel and watch my other videos about hydrocephalus, infertility, and anything. So if you're someone who is living with hydrocephalus, you might have noticed that there is not really a lot of information on everyday topics like should you exercise, should you not, should you fly on a plane, should you not, should you run, is there anything that you should or should not be doing, should you be getting scuba diving, for example, or something like that. So because there is not that much information, going through fertility treatments or IVF is a whole new level of exotic for doctors as well. I cannot tell you how many times I visited a doctor's office, and when I tell them that I have hydrocephalus, and doctor who is not a neurosurgeon or neurologist, I mean here, and they're asking, what is that? And this seems to be something that is not a very common condition, and doctors are still not very sure how to deal with it. The fertility doctor that I am currently visiting, she has not worked with a hydrocephalus patient before, and this is something that we're both learning from. I am really thankful to her, and I trust her with the process. And then also I am having some issues with, trusting people and doctors with my condition, because once I was operated on unnecessarily, but this is something that I'll talk to you a little bit further down in this video, and that was because of my hydrocephalus as well. So with regards to hydrocephalus and fertility in general, infertility is one of the most common conditions related to hydrocephalus. Actually, from a study in 2018 that was conducted on women that were diagnosed with hydrocephalus at childhood and then were traced during their year 20 to 40, only 14.5% of them had birthed a live child, one or more than one. So basically, infertility is something that is quite common with hydrocephalus, mainly due to the changes in pressure in the brain and the fact that your brain is controlling most of the hormone production and is instructing the ovaries that they need to be producing estrogen. This is something that I had noticed as well, because it seemed that my hydrocephalus was building up in my puberty, because I did not have a spontaneous cycle that needed to be induced by medication. I did not really develop, I did not develop breasts, or I did not, have any of those puberty symptoms even. It is very common for people with hydrocephalus to have hormonal issues and to have some problems with balancing hormones. So with this regard, even before I started my fertility journey, even before we started trying to have a baby, I was prepared that at some point I would have to reach out to a fertility specialist. However, in September 2020, I got pregnant naturally and completely by chance. We were not trying, we were not doing anything, timing ovulation and all of that stuff. But I did miscarry in November 2020. So at that point, I was hopeful that I might be able to get pregnant naturally. And then I started visiting a fertility doctor when a couple of months later, nothing had happened. I was and am still really closely monitoring my hormone levels. I know where I am at with regards to AMH, with regards to inhibin B, estrogen, progesterone, and all of those hormones. I am closely monitoring them, and I am seeing a tendency for my estrogen to be declining, to be going down. And though I was having a very high level of FSH hormone back in July 2020, so that was the first time that I started monitoring my hormones, even before I got pregnant. So in July 2020, my FSH levels were at 17.8, and anything that is above 9 or 10 is considered risk of early menopause. Just for reference, in July 2020, I was 31 years old. So early menopause was not an option at all. So I started monitoring those levels, and only through food supplements, and I have a whole video about food supplements that I'm going to link in the description below as well. Only through food supplements, I managed to get my FSH levels down from 17.8 to 8.5. So 8.5 is considered normal. 8.5 is considered okay, even though anything above 6 is but anything below 10 is fine, and 8.5 is way better than 17.8. So I managed to get my FSH levels down. My estradiol is declining though, which was something that was worrying me, and my anti-Mullerian hormone, which is basically the hormone that indicates what is your ovarian reserve, how many eggs do you have that are available and viable for fertilization, is 2.45. Anything between 1 and 4 is considered okay and is considered fertile. So with regards to hormones, I was not having, and I am not having that many issues, even though my declining estrogen and my very high FSH level last year were kind of worrying. But at the end, I managed to balance my hormones through diet and supplements. And of course, after my miscarriage last year, after my pregnancy that I had, even though for just a couple of months, my hormone levels were kind of balanced after that as well, because something happened in my body that, you know, that kind of rebooted the system. When I started my fertility treatment, a couple of months down the line, I had an HSG, a hysterosalpingogram, and that showed that my fallopian tubes were blocked. So that has nothing to do with hydrocephalus. So with my infertility, it is a little more complex because it is partly due to hydrocephalus, of course, and partly due to my blocked tubes. Another factor is that my brain is firing signals. Please excuse my dog, she's going crazy because my neighbors are coming home. Oh my god. Okay, my brain is firing signals that are not very consistent. So for example, my estrogen level can jump up quite quickly and then drop and then jump up again. So it's a little bit weird, and that's because of the implications that my hydrocephalus has on my brain. But my other physiological reason, which is the fallopian tubes, is probably related to a COVID infection and has nothing to do with hydrocephalus. So one of the main things and one of the main implications that hydrocephalus has on my assessments is that when you go in the clinic and your doctor is doing a transvaginal ultrasound, they're looking, apart from checking your ovaries and your uterus, they're looking for a dark spot behind your uterus, a dark area behind your uterus, and this is called the cavum Douglasii. This is a cavity right behind your uterus that is usually void, it's empty. However, if you're someone who is ovulating and has ovulated, and your follicle that contains the egg has ruptured, released the egg into the tube, some fluid from the follicle is going to leak into that space, is going to leak into that cavity. And when your doctor goes in with their transvaginal ultrasound, they're going to see that. They're going to see that fluid and they're going to be, oh, okay, so you have ovulated. That's fine. We can confirm now that ovulation has happened. Whilst if you're someone who is forming cysts in their ovaries and those cysts rupture or break or something happens, basically what happens is that your doctor through the transvaginal ultrasound will also be able to see that fluid from the cysts that has accumulated in that cavity. Is going to be more, most probably, than the follicular fluid released at ovulation, but your doctor is going to be able to see that something is wrong with your ovaries, for example, that there is some fluid that shouldn't be there at the point of your cycle, or that is more than should be present at that point. While I am having a VP shunt, as mentioned, I have a tube draining the excess fluid from my brain into my abdomen 24/7. And I have the end of my VP shunt, so the end of the tube is placed exactly in that same cavity that your doctor will check for ovulation symptoms or for ovarian cyst fluid in. And it's constantly filled with 300-400 ml of fluid, of brain fluid. And anytime I visit an OB/GYN or a fertility doctor and they do an ultrasound on me, they are just so puzzled. They don't know where the fluid is coming from. They think that there is something horribly wrong with my ovaries, that there is something that is leaking constantly, that I'm bleeding from somewhere inside my abdomen or something like that. I even got operated on unnecessarily once because of that fluid, because I did have an ovarian cyst on one of my ovaries, but that was just a normal luteal cyst, so the cyst that is formed from the follicle that has released the egg for ovulation. I did not ovulate that month, and that follicle became a cyst. Nothing special. This happens all the time. It happens all the time, and many women experience this throughout their cycle without even knowing. But because my doctor saw that cyst and then saw all of the fluid behind my uterus, they thought that there was something horribly wrong with my ovaries, and they wanted to get me into emergency operation, which they did. So I did go through that surgery, and at the end it seems that there was no need for that, because basically that was a false alarm. The fluid behind my uterus was coming from my brain, which is something that I know because I have hydrocephalus. I told my doctor that I had hydrocephalus, but they had never worked with a hydrocephalus patient before, and they were just really puzzled by that fluid. So always tell your doctor. If you're someone who has a VP shunt, always tell your doctor when you're going to a gastroenterologist, for example, or an OBGYN or a fertility doctor. Always tell them that you have hydrocephalus and that you have fluid in your abdomen, and that is something absolutely normal for you. You need that to sustain yourself, and this is no pathology. This is not a pathological finding. This is just something that is you. So always tell them that. However, that means that the diagnostics of ovulation and of ovarian cyst rupturing, for example, is getting a lot more complicated with patients with a VP shunt, because basically your doctor cannot tell the difference between, you know, fluid released from ovulation, which is usually no more than a teaspoon of liquid, and 300 milliliters of fluid from your brain. They cannot really tell because of the presence of that fluid in your abdomen. So always make sure to tell your doctor, even if you have been seeing your doctor for a long time. Doctors are busy, they can forget. I had been seeing a doctor for 6 months, and when I went in for our next visit, the doctor was like, "Oh my God, what is going on in your abdomen?" And I told her to, you know, relax. I have hydrocephalus, I have a VP shunt, this is some brain fluid in my abdomen, everything is fine. So with regards to actual diagnosis of ovulation, I need to do a lot more blood work, because the assessment of ovulation with me is only happening through blood work. It is happening with constantly monitoring my hormone levels, and with monitoring my hormone levels before, during the perceived ovulation and post ovulation, so all the time. So another thing is to ask your doctor what they think about how many embryos they would recommend for you to transfer if you're doing IVF, because basically being pregnant and having hydrocephalus is already considered a risk pregnancy because of your underlying condition, because of your cranial pressure, and because of hydrocephalus in general. If you have a VP shunt, it adds a little bit more risk as well, because as mentioned, my VP shunt is placed behind the uterus. So as baby grows and the uterus grows, my shunt might get a little displaced, might get a little deformed, might get a little out of the way. If you consider transferring 2 or more embryos at transfer day, this increases your chances for multiple pregnancy. And this will then mean that you need more space in your tummy, and you need more space, and your if you have a VP shunt, that might get even more squished and even more displaced or something like that. So please consider talking to your doctor. Think about what you want as well. If you'd like twins, ask your doctor. They might confirm, or they might suggest something else. My doctor has recommended that we aim for a single pregnancy, but we're still not clear on how many embryos we'll be aiming to transfer at transfer day, if we get to that point, to be able to achieve that single pregnancy. So please talk to your doctor about that, because that is something that might put you and baby at risk. So there it is, there you have it guys, my experience with hydrocephalus, infertility and fertility treatments. And I know that there is very little information about infertility and hydrocephalus, and I believe that every fertility journey is important, and that it is a topic that's important not only for the individual but for society as well, because every child is important and every pregnancy is important and every fertility journey matters. No matter if you're someone who is experiencing some difficulties because they have an underlying condition or because just facing some challenges that are personally yours. My journey matters, your journey matters, and every journey matters. So thank you very much for watching today, and I'll see you guys later. Bye.